We continue our discussion about health equity this afternoon with a look at cancer in women. Breast cancer is the cancer most frequently diagnosed in women worldwide. Even though survival rates are continually increasing, studies are finding that where you live can impact your chances of being diagnosed and survival from the disease. A national study looked at data for more than 2,100 counties in the U.S. States like Oklahoma, Alabama, Ohio, and West Virginia had some of the highest rates. Now, researchers have found much of the Northeast and several other regions have lower breast cancer mortality rates. They also found access to healthy foods and exercise made a positive impact, while places with higher segregation and lower access to primary care and mental health doctors had a negative impact. So the study suggests improving public health programs could be a key to bridge the cancer disparity gap. Joining us today are Meredith Mendelsohn, she's Executive Director of the Ellie Fund, and Dr. Giselle Perez, an Assistant Professor in Psychiatry at Harvard Medical School and Director of Mind-Body Program for Cancer Survivors at Mass General Cancer Center. Welcome to you both.
Thank you.
So Meredith, I want to start with you and thank you for joining us and all the work that you're doing for the Ellie Fund. What can you tell us about disparities in diagnosis and treatment of breast cancer patients in Massachusetts? And you know, we're a state that's very rich in medical resources, but how does this study reflect on us locally?
So it is a problem. Your zip code is more likely to give a telling of how you're going to do than your genetic code in Massachusetts. And we see very high rates of screening, Black and white women going to get mammograms at fairly the same rates. But once a diagnosis is present, Black women in Massachusetts have a much higher rate of dying from the disease than their white peers.
You are one of the co-chairs of the Breast Cancer Equity Coalition. What is the work of this group all about?
The Boston Breast Cancer Equity Coalition is a group of hospitals, advocates, leaders in the breast cancer community, all working together to highlight the disparities, talk about the barriers that prevent Black and brown women from getting access to care, and setting action so that we can change that.
Giselle, I want to ask you, a new study suggests that hot yoga helps ease some of the symptoms of depression. Have studies shown that there's some correlation that yoga can also benefit mental health issues in women who have breast cancer?
There are a host of studies that are up and coming, continue to emerge, showing the benefits of yoga and other mind-body therapies in improving mental health symptoms in and around related to cancer and beyond. So if you continue to look at the literature, the more that you're engaged in these practices, the more benefits that you can glean over time.
What are some of the changes that cancer patients experience with their relationships after their diagnosis?
So many changes from the moment of diagnosis and beyond. There are relationship changes, so with partners, within one's family, within one's social network, wherein there are a lot of individuals who feel very much connected, feel supported, and at the same time there are people who then sort of surprise you and become disconnected and disengaged. And so people, although they might be able to identify a number of support networks within the cancer experience, they also feel often isolated, especially when it comes to the distress that they do experience.
After a patient has completed treatment, is declared cancer-free, there's still a fear of recurrence, right? And the anxiety and stress around that and other post-cancer mental health issues.
Absolutely, and actually that's one of the things that catches patients by surprise, right? One often expects that once cancer treatment ends, everything's done and you can move on. But it feels as though everything else in your life moves on and you're stuck behind. It's at that moment that you're processing the changes, the impact that the cancer experience had. You start kind of now experiencing a lot of the post-treatment symptoms. Trying to become reacquainted with your body, especially if you've gone through surgery, after chemotherapy, trying to become reacquainted with your sexual health. And also feelings of worry, fear of recurrence, uncertainty, not sure what you want in the future, changes in your identity, changes in values. So there are a lot of changes that women and others just don't expect
think about
in our
it and
cutoff-
don't expect.
And don't expect. Yeah.
WCVB has been a very proud supporter of the Ellie Fund for years, and Meredith, you and I talked about this. You and the Ellie Fund started the Equitable Pathways to Breast Cancer Care Initiative in 2020. What are the 4 pathways?
So thanks for that question. We are grateful for your support. Absolutely. The 4 pathways are different ways that patients can get access to Ellie Fund services. One being that more upstream at the hospital, so maybe working with radiologists, surgeons, not just waiting for social work or patient navigation to get you help. Certainly we're working with community health centers to try and identify people that are getting diagnosed at the 52 community health centers in Massachusetts and then go to a major hospital for treatment. Self-referral is a big one for the Ellie Fund. We launched our own self-referral program, and so patients can apply to us directly in the privacy of their own homes with people that can support them with the application. And we are really, really excited about that. And also, it's really going out into churches and to the communities, and clinical trials is the 4th pathway. And we are very dedicated to making sure that Black and brown women have access to life-saving clinical trials.
And it's important to talk about the cost or not the cost of the Ellie Fund services.
The Ellie Fund services are free of charge, and there are only 2 requirements. 1, that you are in active treatment for breast cancer, and 2, that you either live in Massachusetts or you're being treated in Massachusetts.
And you have developed a very close connection, as you said, with a lot of the community health centers in the neighborhoods in and around Boston who know about the Ellie Fund and can make referrals?
Absolutely. And most importantly, that the community knows that we are here for anyone who's been diagnosed with breast cancer. We would like the Ellie Fund to be a household name before a diagnosis so that people don't spend precious time looking for resources, because we know that the faster you treat your breast cancer, and that does really contribute to the disparities in outcomes, is the time of diagnosis to treatment. The Ellie Fund can help you get to treatment faster.
All right, Giselle and Meredith, thank you so much for being here. We're going to post information on how to contact the Ellie Fund on our website at wcvb.com/Cityline. Their support and services are life-changing for so many patients and families.